Hi, welcome to your checkup. We are the patient education podcast where we bring conversations from the doctor's office to your ears. On this podcast, we try to bring medicine closer to its patients. I'm Ed Dulesky, a family medicine doctor in the Philadelphia area.
And I'm Nicola Rufo. I'm a nurse.
And we are so excited you were able to join us here again today. So what are we going to talk about today, Nick?
Today we're talking about the age-old question, why am I so tired?
Well, let me ask a rhetorical question to the people listening to our fine show.
Alrighty.
Have you ever had one of those days where you wake up tired?
Yes.
You go through the whole day tired, and then somehow you're still tired even after you sleep.
Yes.
She says, yawning. As she yawns. Like, what's going on in this situation?
I don't know, brother.
If that
I would
sounds
like to know.
Familiar. You're definitely not alone. This is one of the most common things that people come in to see us for. And we're going to talk about it today.
Really?
Oh, yeah. Maybe not even in a whole like sit down visit, but people come in like even usually it's like a, hey, is anything else going on? And they're like, oh, yeah, I'm tired. That's so funny. It's poetic that you're yawning. So today we're going to talk about it, and we're not going to talk about why you're tired, but we're hopefully going to touch on what's going on in your body and what practical steps you can take to fix that.
So I think the first thing we have to do is clarify what we mean by tired, because there is a difference of being sleepy, like you didn't get enough sleep the night before. But we're going to talk about the deeper kind of fatigued where you just feel drained, like there's no more energy left in the tank, even though maybe if you did sleep the night before, you know, you're not just sleepy, you're tired.
Right. So and when we're seeing people for this, we usually try to think about it in a pretty simple way, because most of the time fatigue comes from one or a combination of these three areas: your sleep, some elements of nutrition, or something medical going on underneath. And so just like we would approach this if we were seeing someone, we're going to try to go through this. So we'll start with sleep. And I think you and I have been talking a lot about sleep at home. So to be honest, this is a huge one when it comes to people being tired. And people often will hear this and then say like, yeah, I know I should get more sleep. But it's not about just getting some sleep. It is about getting enough sleep and good sleep quality. To put it plainly, if you're an adult listening to this, you need at least 7 hours. And a lot of people just aren't hitting that consistently. To expand on that a little bit, there are different age ranges of people who have different requirements for sleep. Like teenagers, 13 to 18, should be getting 8 to 10 hours of sleep. And we see a lot of teens like in our life and during the day that just aren't getting that much sleep. There are school-age children, 6 to 12 years old, who should get 9 to 12 hours a day of sleep. Preschoolers, 3 to 5 years of age, 10 to 13 hours per day, including naps. And toddlers, 1 to 2 years, 11 to 14 hours per day, including naps. And infants, 12 to 16 hours per day. There are two elements that I wanted to bring up that I've picked up in the materials I listen to learn things, and we've been trying here at home with you, Nikki. One of them is sleep efficiency, right? Mm-hmm. Sleep efficiency, I would try to describe as the amount of time that you're in bed and the time that you are asleep in bed, and trying to make those things as equal as possible. Do you mind sharing your recent experience with the experiment we've been doing? As a point, like to illustrate the point?
At the bedtime?
Yeah.
Yeah,
This is so poetic for the episode. You sleepy girl.
I'm sleepy. You know why? Because I like woke up on my own at 5 a.m. like when I normally wake up, but
Today?
It's a Sunday. And I like woke up, kind of stirred a little, saw what time it was, and then I shut my eyes and I fell asleep for like 2.5 more hours. And I'm always sleepy when that happens, you know? I should have just stayed up.
I didn't know that.
Anyway. What was I saying? The bedtime.
Yes.
So we realized we were probably spending too much time in bed. And by we, I mean me, because Eddie here gets horizontal in bed and he's catching flies about 2 minutes later. Whereas we would get in bed at like 8:30 or 9 and be like tired but not sleepy, you know.
Mm-hmm.
You fall asleep, I don't. So then I don't get a good night's sleep. So then you told me to see what happens if we go to bed later. So then the last couple of nights we've been going to bed at like 10:30-ish.
Mm-hmm.
And sleeping through the night. I don't wake up until my alarm goes off.
Yeah. Well, it comes from a point of thinking that, like, reprioritizing that the wake up time is the thing to worry about. Mm-hmm. And I've been starting to like recenter this with people that like, it's not about bedtime so much. It is about wake up time. And so if you find the time that you have to consistently wake up during the week, even on weekends, if you're going to be strict about this and really try to change your life, for an adult, you could pick 7 hours, or if you convincingly know that you're an 8-hour or 9-hour person, take the bedtime, move it backwards. Or no, excuse me. Take the wake up time, move it back 7 hours, and then add a half hour and see what time that takes you. And you might be surprised because I've met plenty of people who, I mean, we wake up really early. Like we're waking up like usually in the 5 o'clock hour. And that's just like not like a random thing that's become pretty routine for us. But there are people who are waking up at 7 a.m., 8 a.m., and they are going to bed. They're like going to lay down in bed at 9 p.m., which is 10 to 11 hours in bed. So then these people are like, oh, I may doze off, or I'm in bed for an hour beforehand. Mm-hmm. And like we've talked about the bed being for two things, sleep and sex. And we have a nice older episode about sleep that people can go listen to. But if you're sitting there ruminating in thoughts or not falling asleep for an hour, there was not enough sleep pressure that was made.
Yeah. It honestly worked. Everyone should try it. Except now if you have a spouse who might be affected by your late sleep time, because we like to go to bed together.
Yeah.
So now Eddie's like, oh, I'm kind of more tired. I feel like I just lost an hour of sleep. But really, it's better for the the group average if I'm sleeping a full night.
It absolutely is. Well, I'm like getting back from work these nights and I'm like passing out in your lap now when we're watching. I mean, it's been Dance Moms, guys. I know. I got a FaceTime from my buddies last night when they were hanging out and they were like, what are you guys doing? And I was like, I do not care.
You could have lied.
I am proud. No, I am like, love what they love. And genuinely, I fall in love with these things that you do, and you have great taste. So I'm falling asleep.
Thank you.
You do. You're perfect. And so we're falling asleep in your lap watching Dance Moms. But hey, on average for the group, this is better. So yeah, sleep efficiency and sleep pressure. Think about it. Definitely still not advice. Also, there are some sleep hygiene things, like you should not be on your phone when you are in bed. That's a big no-no, and I realize people do things for fun, but if you really want to make a meaningful improvement in being tired, this is an opportunity for improvement. Try to keep your bed cool and dark. One thing I've picked up, and maybe we do like a whole sleep episode again, but if you sleep with down comforters, you're sleeping in a ski jacket. And so if you think about that, when you're in the middle of the night and you might get a little warm.
Is that what ours is?
Yeah, I think so. And so one could consider sleeping in a cotton blanket instead, and purchasing one of those. You can keep your comforters for the looks. And keeping a consistent wake up time and sleeping. So, you know, the body likes routine more than we think. There is the occasional person who I see who like works overnight, or they have like a lot of family responsibilities. And so it's like, it's an uphill battle anyway, but I feel like a lot of people lean towards the medicine to sleep, or the supplement to sleep. And a lot actually, and I don't know if you see this too, or like hear about this when you're like on social media, but lots of people reach for the supplement, but I do think that the vast majority of cases, like some simple behavioral changes that are really thoughtful and meaningful, can go a long way.
I agree. It's been working in our experiment.
It has. And another quick coaching moment that if you didn't fall asleep after about 20 minutes, you should get out of bed. You shouldn't do anything that's too stimulating, like don't watch TV, even don't read a stimulating book. Some people might like read the dictionary or an encyclopedia or do something just frankly boring until you feel like you're tired again.
Oh, I do my words. What is that called?
You know, there were the couple times when you got like, you were super worried overnight and I was like, Nikki, do your words. And I've completely forgotten about this technique. So I
forget what it's called.
And it was a thing we were doing for a while.
No, it works. I do it sometimes, like if I can't sleep. Wait.
So you were saying your
my words. So I thought I saw a different name online, but I forgot what the actual name is. Some sort of cognitive shuffling. It looks like, but you pick a word. So like bed, for example, and then you go through each letter of the word and you find, or like you try to think of 3 words that start with that letter. So like B would be like boy, beach, banana. E, elephant, excited. Edward. And then like you go on and then you do that whole word and then you just like keep doing a new word.
Oh.
Until you fall asleep.
And you try this
and
it works?
Yeah, it does. I do it a lot actually.
I don't know why I like wake up in the middle of the night and like you're flustered and startled sometimes. And I'm like, Nikki, do your words. But like, I don't remember talking about this ever. And maybe that's on me. Maybe we have talked about it, but that's great.
Yeah.
Thank you.
You're welcome.
Any other thoughts about sleep before we move on to the next opportunity for improvement if someone is tired?
Mm-mm.
Okay. So the next thing we're going to talk about is some nutrition. We're not like diving into a whole nutrition talk right here, but you know, your body needs fuel to make energy. So if you're not getting the right nutrients or you're not eating in a consistent way, you're going to feel that. And so we see this a lot with people who skip meals during the day. They often feel then exhausted in the afternoon and perhaps overcompensate later on. Or when people are trying really hard to eat healthy, it can tend to end up being overly restrictive, and then they're just literally not getting enough energy in. And so it is a good idea to try to eat balanced throughout the day and eat healthy. From a weight loss standpoint, which we always talk about here, is that if you don't eat anything in the beginning of the day, there builds some sort of like potential energy of hunger, like ghrelin as a hormone becomes increased, released from your stomach, and will rear its head at some point to make you act on it. And so eat during the day. Manja. I know some of the folks back home are going to like that. All right. And so this one's cool because we learned a lot about this recently, and this has been personal and life-changing for me. There are some specific nutrient deficiencies that we can look at. I'll gloss over that B12 is one that could be checked. B12 can lead to an anemia, and especially if you're eating exclusively a plant-based diet or are practicing veganism, then you might put yourself at a little bit of an increased risk for a B12 deficiency, which can affect people's energy. That's kind of all we'll leave at B12 because we have a little bit more to say about iron.
Ooh.
Yes. This can be a big one, and it's called non-anemic iron deficiency. We may or may not end up doing a whole separate bump out episode where we give this the spotlight, but iron deficiency is the most common cause of anemia. Anemia is a low red blood cell count. Red blood cells are the cells in your blood that deliver oxygen to tissue to make things go. So if you don't have iron, you can possibly develop anemia. But in the recent years, there has been more of a lens, a magnifying glass, if you will, drawn to what if iron deficiency itself, even without anemia, just iron deficiency can lead to some problems. And so many people have this that regular labs, when they're ordered and they are spat back at you and they give you like the reference range of what's normal and abnormal, those numbers are based off of population level data, not something that someone came up with to say that's normal or abnormal. It is literally based on the average of people. And so many people have iron deficiency that the normal reference range for iron or ferritin, which is a measure of iron stores, is much lower than what actually people need. And so even if you're not technically anemic, low iron can make you feel really drained. It can also lead to some problems with concentration. It can also lead to some problems with exercise tolerance and a few other things. Now, I don't have, some of this isn't right in front of me, but this is from my previous reading, and it's very common, and it's an easy fix with some supplementation every other day with just how the iron works, with how it's absorbed in your body. Look, I'm not being a champion of low iron here, but maybe I am. I'd like to think that supplementing my life with iron every other day has made a big difference in my energy levels and ability to concentrate a little bit, as I have a tough time concentrating on things.
Well, you also had some labs that suggested that might be good to supplement with.
I did. And so that's a good point that, like, we're going to talk about how the visit might go. But you don't suffer from this, I don't think, but I'm like very pro iron right now.
Yeah. I mean, it's like significantly improved your life, I feel like.
Do you notice it too?
Well, I noticed based on like the things that you say.
Good point. Well, I remember like at the end of the workday, I would like be like grabbing my head and I'm like, I feel so like tired and I don't understand why. Like this doesn't make sense. Like I sleep the right amount. I eat the right things. I exercise and I'm not sad. And like, it doesn't make any sense. And
well, Lauren, the same thing happened with her.
Yes, it did.
She said the exact same thing. Start taking a little iron. Good to go.
Yeah. And we're not here to be like medicine influencers and make everyone run to their doctor to get their ferritin checked. But in a very real way, I sometimes feel like fatigue or being tired can easily be blown off in a visit when there's a lot of other things going on. And after this episode, maybe you can have like a really nice structured framework of things to hope for at a visit with someone when you're going over this. And maybe iron is on that list. Yeah, very big on.
It's an easy one too.
It's easy. It is an easy one. It's affordable. It's like over the counter, and it can make people a little constipated if you replenish it, but there's ways around that. So I don't know. Should we sit on iron for a little bit, or does you feel like that got the sunlight that it needed?
I don't know. What else do you have to say about iron?
I think that was it. I just wanted to kind of increase awareness of it a little bit. And then there's things like vitamin D, and like that can play a role in energy. And honestly, like so many people have low vitamin D. Go spend some time in the sun. They also make supplements if you are interested. And if anything is low, could it be affecting you? Maybe. And so why not essentially try to fix it up? So again, when it comes to nutrition and eating, we try to keep it simple. Are you eating regularly? Are you getting balanced nutrition, a mix of protein, carbs, and healthy fats? Are you drinking enough water? Because honestly, just fixing these things can really make a noticeable difference.
Alrighty. So we've talked about sleep, nutrition, but when do we start thinking about more like medical issues if someone's still tired and feeling wiped out?
It usually just comes up hand in hand. Some of the first things to go over would be sleep disorders, like sleep apnea. This is for the person who's like thinking like they're falling asleep when they're like at the wheel, or you're at a traffic light and you're worried about like your eyes closing. In sleep apnea, this is a chronic condition while you're technically sleeping, but your body's not getting good oxygen overnight because your body stops breathing X number of times per hour. Your body goes into a fight or flight mode, and the sleep, while it appears that you're sleeping and you wake up and you tell people that you slept, other people may notice that you're snoring. They may notice that you stop breathing, or maybe you're gasping for air. And that leads to something called a non-restorative sleep. And if there's one thing we can do on this episode is try to raise a little bit of awareness for sleep apnea because, oh my goodness, it is so incredibly common. And the people who have high risk factors are everywhere. And so if you are thinking about this and you're thinking about fatigue, sleep apnea is a great place to start. We also have a wonderful episode on sleep apnea in the past. There are also other things that are important, like mood-related things, like anxiety or depression or other mental health problems. These can absolutely drain your energy. They can cause you to feel tired and fatigued. And so these are things to chase and to really open your mind and say, like, is this something that's happening and making me tired? We also see this a lot. And then there are some more straightforward things that can be checked with quick labs, like anemia, like we've alluded to before, or thyroid problems. I think thyroid problems happen a lot less than people would like to believe. There's also hormones that are secreted from leptin, which is a hormone that's released from adipose tissue. And the leptin can signal to the thyroid to increase the TSH level. And so if someone has obesity or is overweight, then their TSH level might just be elevated anyway. And so then a lot of people might end up on levothyroxine who don't really need it, which is the thyroid hormone replacement. But anyway, if you have overt hypothyroidism, that might be leading to your sleepiness, or some blood sugar problems can do it. Nikki, can you tell us maybe, after thinking about all of those things, for someone listening to this, like when might they think about going to actually get checked out?
So usually if this is something that has been going on for a few weeks, maybe a few months, if it's affecting your day-to-day life, or if something just feels off.
And, the visit itself is usually pretty straightforward. We talk about a lot of these, one could talk about a lot of these things, like your sleep habits, stress, checking some basic labs to make sure that there's nothing too crazy, and just try to find something that could be simple and fixable. So when you step back and look at all of this, fatigue itself usually isn't random. It's probably your body responding to something. And a lot of the time, it's actually giving you a pretty clear signal that, hey, something needs to change. And it's best when you can be part of the solution as well. So here's a quick tasty tip, if you will, before we head out for the week. If you hit the afternoon crash and you're feeling really tired and the instinct is to grab an energy drink or coffee, try instead to drink a glass of water and have a small snack that has protein and some carbs, perhaps something simple like an apple with peanut butter, yogurt with granola, or a protein ball that is packed with literally one of everything, seemingly. A lot of times that will give you more stable energy than caffeine does. At the end of the day, sleep isn't a luxury. It is foundational to your health. And if you're always tired, it's worth paying attention to because it matters. You shouldn't have to feel a negative way if you don't want it to. Small changes in sleep and nutrition can certainly go a long way. We were spending the 1:40 hour to just about now at the time of recording with the Mets on the top TV, and it's been an exciting start to the season so far. We were maybe a couple feet away from another walk-off win, and
They stunk it up.
Yeah, we did. This one we lost, but overall, very happy with how the season has started, and I am looking forward to be hurt again in 2026 with Mets baseball. You proposed a good theory. Well, actually, let's talk. Let's see. How are you?
I'm great.
What makes it great?
Well, it's Sunday and we're hanging out and you're about to make me crab cavatelli for dinner.
Yeah, those are pretty good reasons to be great. How have we been spending some of our time when it comes to entertainment? This recent 36-hour stretch.
We've been watching Dance Moms for approximately 2 days straight.
I gotta say,
It's been great.
Can you I don't think I understood how important Dance Moms was to you in your life.
I mean, Dance Moms is the best show on television, best reality show on television. It is so unhinged. And you just could not air any of that today, which is what makes it so great.
Yeah, I agree. I had no idea. I pretty much had zero idea.
It's really a cultural phenomenon.
Existed. And you knew everything about each of them and what they're up to in their current daily life.
Well, yeah, Brooke just got married. I actually did like kind of a recent catch up because Brooke just got married. So then I was like bopping around to all of them, seeing what they were up to.
Wow. Yeah, in terms of this type of reality TV, you know, in comparison to what happens now, they are so unfiltered and raw.
I know, it's amazing.
And I think that's what's interesting. Like, I don't think these people, we're 3 seasons in, I don't think these people realize that there's a camera on them that's going to be put out to the world.
Mm-hmm. It's quality is what it is.
Yeah. So what timeline are we looking at? Like how old were, like, where were you in life when this was coming on strong?
I was in, I think I was in college, either like high school, end of high school or college.
Was this like on TV and this was like broadcasted?
Yeah, it was on Lifetime.
On Lifetime.
Mm-hmm.
And was it on weekly?
Uh-huh.
There are 30 episodes in a season.
Mm-hmm. Yeah, there are.
They're about an hour each. So this was on the vast majority of the year?
Yeah.
Was this pretty close to live filming?
I think they churn them out pretty quickly.
Huh. Similar to some shows that we know and love over the summertime.
Wow, I can't wait for Love Island.
Yeah, no, that's going to be great. We do have a very consistent thread of television entertainment. I'm very happy now that my Mets are back. And we, at all times, have some sort of reality television waiting on deck.
Yeah, it's escapism at its finest.
Your protein balls, I think maybe we've talked about these a little bit. The perhaps perfect snack have just gotten a little upgrade. Can you share what you've done to this newest iteration of them?
Yeah, I put my beloved chia seeds in this batch for some more fiber because you need to eat more fiber. It's very important.
Why do I need to eat more fiber?
Because it's good for you.
That's good for me. I'm going to eat more fiber. We're going to try to work that in there. Yeah, that's been great. Anything you're looking forward to this week? And you can't say the weekend.
I was going to say the weekend. This week. Do we have anything this week going on? Probably not.
We keep the weeks pretty light in terms of what we plan on doing.
Next week, I'm looking forward to a short work week. That'll be fun.
Yes. Did you also take off Wednesday or just Thursday? Thursday, Friday.
Just Thursday.
Thursday, Friday.
Mm.
Yeah, I'm very excited. Pardon me if I'm a little distracted. I'm waiting for our neighbor to possibly come here. It's so nice. But it's also sort of like when someone who does some maintenance on your house is planned to come from 12 to 8 on any day. They're like, yeah, the plumber will be there anywhere from 12 p.m. to 8 p.m.
Yeah, our neighbors are from Cuba, right?
What? Yeah.
And Eddie saw him outside earlier and he's like, oh, we're making something.
Croquettes.
Yeah. He's like, oh, we're making them today. I said, oh, I guess they were talking about them at some point previously. So they're making them today. And he said he was going to bring some over. So now we're waiting to see if he does.
Yeah, he said sometime between 3:30 and 4. And as of now, it's 5:05.
Maybe he got caught up watching the Mets lose.
Maybe. There is a guy 2 houses down who is a Mets fan in this very Philadelphia city. So I am...
Well, we are in Philadelphia.
Yeah. Well, I also really haven't talked to him. I wear my Mets hat inside, and I do usually take it off if I go outside. I would say Phillies fans are very respectful, though.
You haven't talked to him about it?
No,
we usually gossip with his wife.
We only talk to his wife. Yeah. Of which we haven't seen her too often. Do you see her if you're ever like out walking Ollie in the afternoon?
Not really, no, actually.
Yeah, I feel like this season of life has kept us pretty kind of disconnected from our neighbors.
Yeah.
I mean, in part by design. That's how we
yeah.
But but just otherwise, I think like wee earlies of the morning we're walking Ollie, or in the evenings, big time as well. Look, I've been going to the gym. Like we have been going to the gym. I went today and I did legs again. And I've talked about this like a couple of weeks ago, how my form changed. And I feel much stronger in my lower extremities. And moreover, I received a badge of honor today at the gym where someone looked around and they picked me to spot them on the bench. And he cited my ability to squat the weight I was squatting. And that felt nice. That felt nice.
Be proud of yourself, Eddie.
I am. And then I bought myself a job like 5 times in the next 15 minutes. So I really couldn't leave the area because then he was depending on me. That is a social contract in and of itself. And I bet that guy doesn't realize that I'm talking about him right now, but maybe his ears are itching. But he also went to Rowan. Go Profs.
Really?
Yeah. He recognized it from the hat that I was wearing. Well, anyway, what do you think? I've got some crab cavatelli to get to.
You do.
And we've got some teaching to do. So let's do this tired one. Okay. So thank you for listening to another episode of Your Checkup. Hopefully, you were able to learn something for yourself, a loved one, or
a tired neighbor.
You can visit us on Threads. You can check out our Instagram, or you can share this with a neighbor or a loved one. And we look forward to seeing you next week on another episode of Your Checkup. But most importantly, stay healthy, my friends. Until next time, I'm Ed Dulesky.
I'm Nicole Rufo.
Thank you and goodbye.
Bye.
This information may provide a brief overview of diagnosis, treatment, and medications. It's not exhaustive and is a tool to help you understand potential options about your health. It doesn't cover all details about conditions, treatments, or medications for a specific person. This is not medical advice or an attempt to substitute medical advice. You should contact a healthcare provider for personalized guidance based on your unique circumstances. We explicitly disclaim any liability relating to the information given or its use. This content doesn't endorse any treatments or medications for a specific patient. Always talk to your healthcare provider for a complete information tailored to you. In short, I'm not your doctor.
I am not your nurse.
And make sure you go get your own checkup with your own personal doctor.